Good afternoon. This is Ed Ullman from the Mountaintop community of Tannersville, New York at our Wellness Center Pharmacy. Well, we're 10 weeks in. Just 10 weeks ago, New York State reported its first coronavirus case. Since then, close to 20,000 New Yorkers have died from the virus, with a third of those deaths being patients that are in nursing homes or some type of long-term care. And New York State continues to be the epicenter of the United States with 1/3 of all reported cases. In these 10 weeks, we also have now increased our national unemployment rate from 4% to now 14.7% and growing. Wow. On the positive, New York State is showing promise. While the governor has extended his pause order from May 15th, or this Friday, to June 6th, several of our lower risk upstate regions will be allowed to begin reopening their economies after Friday, as long as they meet certain key markers. So what are they? Regional planning and coordination. Now, here in Greene County, it's a great initiative that's coming together with 5 of the other surrounding counties that share a lot of common interest with the executives of these counties and the business community coming together so that we can have intelligent ways to plan the reopening within our communities. One of the other measures is that they have to continue to measure their rate of transmission of the virus. Now, they're going to continue to look at hospital admission reductions, and the communities will have to show that they have the bed capacity to handle any surge that occurs from the virus. And then we go to testing. And we all know this is the number one thing to get us back into an intelligent planning position. Now, New York State has now conducted 1.2 million tests, or about 25,000 tests per day, with 28.2%, quite a significant increase from our last report, of individuals that are now testing positive for the virus. Again, this is not where they had the virus at one time. This is where they now have the virus, either where they have symptoms or they're asymptomatic and it's in their system. While the upstate rates are lower, Ulster County, our neighboring community, still reported this morning that they had a 17.5% rate, or that 4.9, almost 5% of the entire county's population is now tested positive for the virus. And remember, these rates are coming in, and it still is going to have what we call false negative testing. It could be that the sample that was taken from the nose, which is a tough sample to get, didn't get the virus and therefore tested negative. It can be that there were some problems at the laboratory during testing. So the numbers we're talking about can only be higher, not lower. And so until we start, and this is on testing, until we start aggressively have antibody testing to confirm who has had the virus. So we're just not going to know what percentage of the population could possibly be safe from further reinfection and therefore no longer would be a transmitter of the virus. In New York City, for example, antibody testing is now showing that 24.7% of the population has already had the virus. They've been quarantined, they've been put away for a period of 10 or more days, and they have positive antibodies for it. Now, in New York State as a whole, it's 14% of individuals who have had their antibodies tested are coming up that they had positive transmission of the virus. So what we got to look at now is that if we are looking at these fairly high rates with who has antibodies, and we add that to the 28.2% of individuals that are now being tested coming up with positive testing for the virus, And we then turn around and say, we couple these things together. New York State, especially the New York City metropolitan area, is fast approaching that 50% mark when herd immunity will kick in. And that's when the majority of a population has had the virus, and therefore has a much less opportunity that their community will be spreading the virus. And then hopefully, if there's less and less individuals that are candidates to spread the virus then will just die. So we in New York State are ahead of the United States curve because we have been the epicenter. Now, the next one that the counties will have to, this is the marker that's been laid out by the governor in order to open up, is with tracking. And this is where each county must have a system in place to track and quarantine individuals who have been in contact with a person that's tested positive. Here in Greene County, we will have to have at least 14 individuals who will be responsible for doing the tracking in the county. The counties will have to show what their business is and what they're doing for prevention in order to be able to maintain the public safety. And last, there will be an evaluation process. And once a county has shown success in the achievement of the first phase of their reopening, then they can go forward with phase 2. A couple of the areas that this week I felt good about is the movement towards self-testing for the virus, when a person can actually test themselves, get the specimen, and then bring it directly to a testing center. This will help quite a bit. And then we're also going to start to see what I call in-house testing for the antigens that are being released by the virus in someone's body. And this testing will be similar to what we're all used to of having our throats tested to see if we have strep in the doctor's office. So that's good news. I also was very impressed this week that in the past 6 weeks, over 2,000 hospitals in the United States, that 2,000 hospitals have moved to introduce what I call convalescent plasma programs. Now, this is where we are able to define that someone had the coronavirus, they produced antibodies, we can go and get their plasma, we can take the antibodies from the plasma and re-inject it into another patient that needs it. Now, this is not a new technique. We've been doing this for close to 100 years in this country, if not the world. But we're now getting aggressive for this. So along with some drug therapy that we're now starting to see that can reduce the amount of time by about a third that someone who's in a more serious stage of the coronavirus, that we can help them, especially if the earlier we can get the drug to them. We now have this plasma injection that can also be demonstrating that it can help individuals, especially individuals who are incubators and in their really, really tough times. So that was very promising. I also like to continue with some of the comments that I receive each week. And what I've been asked about the epidemic this week was, well, how long does this virus last on things? Good question. And if you just kind of look at it, that we know that if someone sneezes, that it can go around us for about 6 feet, and it can stay in an aerosol type of way for about 3 hours. And we then know that if we have packaging, if we have cardboard, those type of things, that the virus can actually stay up to 2 days on that. But the most challenging thing for us is that when we look at where the virus is on metal, stainless steel, on plastic, there it can live for up to 3 days. So that's why we need to be very diligent about cleaning doorknobs and countertops and so on. But good question. Second one was, why are folks of color so hard hit with the virus? I guess if there's one little area where the virus has ripped off a wound or a scab off of a wound, it is this. And minorities have been hit the heaviest. Whether it's Native Americans and all throughout the West, But in particular, African Americans appear to be cruelly impacted by the virus, where African Americans might be about 12.5–13% of our population. They're having about 28 to 30% of all the coronavirus cases. You know why? I think there's a whole series of things, but I think minorities live more in urban areas, and the urban areas have been hit. The housings are more congested. There's more public health challenging in their communities. I think the diets of many folks who are living in poverty areas are tougher. And it could be improved. And I think with the African American community, what I have observed as a pharmacist, there's a tendency to have greater hypertension, greater obesity, and also with diabetes. So I think all those things come together to now be exposed on what better job we have to do with our minority populations. The final one was, well, will the warm weather help stop the virus like the influenza goes away right about this time? No evidence to that. No evidence that the warm weather will retard the expansion of this deadly virus. So now it appears that we are now going to be testing the moral structure of our democracy. The moral structure of our democracy. Are we one nation, or are we a collection of states with different agendas? Will our individual rights as Americans override our moral obligation to protect the whole? When another surge in the virus occurs, and it will we start pointing fingers? Or are we going to be prepared to meet these surges as a nation? And I'll give you just one example. If the state of Georgia, which has been very aggressive now in their reopening plan, if this results in new surges, what do we do? Do we finger point? Do we ask questions? Do we just roll our heads? Or do we as a nation go down and help Georgia to stop the virus and be able to learn from it? This is our moment of truth. Next few weeks and months are going to continue to be challenging for all of us. The big question will be, what is it going to take for ordinary Americans to feel safe again, to come out of the shadows and re-engage with their communities? In my opinion, this is going to be a visceral or a gut sense that we all have, just as much as it's going to be a science sense. Finally, I want to continue to thank my staff, the volunteers who have joined our team to be here to help me, to help our community. And I want to say a loud thank you to everyone who continues to give to our Patient Assistance Fund. The stories of helping others are just magical. And I also want to thank a big shout out to this angel from Twilight Park who made 70 cloth masks so we could give out to people for free. Beautiful. And I had a donor this week that said something, and they said, you know, this is the best of America. I'm making a donation to my local wellness center that knows the people. And in turn, the wellness center distributes the money where it's needed. Is that America at its best? See you next week.